Hi, my name is Bertrand Dirk, and today we'll be discussing about hemiplegic migraine. Do you suffer from hemiplegic migraine? Well, let's find out. Now, hemiplegic migraine is an unusual and often alarming presentation that can mimic stroke-like symptoms, multiple sclerosis, epilepsy, or even metabolic disorders. Now, the term hemiplegia is a condition where one side of the body is weakened or paralyzed. Now, technically, hemiplegic migraine is a subcategory of migraine with aura. And during a hemiplegic migraine attack, sufferers will experience weakness or paralysis of one side of the body, as well as more typical migraine aura symptoms such as visual sensory disorders or even speech disturbances. So let's go over the symptoms that hemiplegic migraines will have. So they may have severe headaches, and they are usually on one side of the head. They may have weakness or paralysis on one side of the body, whether it be the left side or the right side. They may have loss of muscle control, where they can't physically move their arms or the legs well. They may have an inability to comprehend or formulate language, hence their language may be slurred as they speak. Numbness or tingling in the face, arms or legs can also be present. Dizziness, drowsiness, and even flashing lights in the vision or double vision or any other visual disturbances may occur. As a result of this alarming symptoms, they are displayed in the hemiplegic migraine. Diagnosis must exclude all other possible conditions that may present similarly. For example, migraine with aura, multiple sclerosis, metabolic disorders, conversion disorders, facial palsy, stroke, or even epilepsy. Now, another characteristic that can differentiate hemiplegic migraine from classic migraine with aura is that that minor head trauma can actually trigger hemiplegic migraines. Now, there are two types of hemiplegic migraine. The first one is called familial hemiplegic migraine. Now, this subcategory refers to sufferers that have one or more first or second degree relatives that also suffer from the same condition. There are several genes that may have been identified that can contribute to this condition. The second category is something called sporadic hemiplegic migraine. This category refers to sufferers that do not have any close relatives that suffer from the same condition. In some cases, similar gene mutations have been found in sufferers of sporadic hemiplegic migraine. This is referred to as sporadic gene mutation, hence the name sporadic hemiplegic migraine. Now, there are no significant differences in the prevalence of these two types of hemiplegic migraines, and hemiplegic migraines often present with brainstem symptoms in addition to normal aura symptoms. They are often mistaken from epileptic attacks and unsuccessfully treated as such. So, then what is the cause of hemiplegic migraine? Now, often hemiplegic migraine have a genetic component. However, they are often triggered by head trauma or an irritation to the neck joints in the upper three cervical spine of the neck. Now, in those individuals that may be suffering from hemiplegic migraine and have no underlying pathology or disorder that can be recognized, another known cause is a sensitized brainstem. This relates to an irritation in the neck, which then causes the brainstem, which houses a lot of the cranial nerves, to become hypersensitive and can thus cause pain that can travel up into the head, or neurological symptoms that can travel down the body, which can be known as the hemiplegic migraine symptoms. Now, if you believe that you do suffer from hemiplegic migraine, that you do have some type of headache or migraine that is usually on one side of the head, and you do get all these other hemiplegia symptoms that travels down the arm and the leg, then most chances are that you may be suffering from hemiplegic migraine. What we recommend is that you do seek medical advice and seek a professional who specialises in dealing with chronic headaches or migraines and who have a keen desire and understanding of what hemiplegic migraine is. Once you have been diagnosed, then treatment can then begin, and successful and safe treatments can be done for hemiplegic migraine sufferers. For further information on hemiplegic migraine, feel free to call us on 1-800-HEADACHE or even email us. My name is Bertrand, and hopefully you have a clearer understanding of what hemiplegic migraine is. Thank you.